into my thoughts on the surgery, but kind of the process first. So it, as I said, is a pretty serious surgery. I know I'll be in the ICU for a few days, then just in the general hospital for a few days, and then my surgeon requires that you stay within a 2-hour driving radius for several weeks after the procedure. So we'll be staying in a hotel for a couple weeks, and then my house is within a 2-hour radius of my surgeon, which I'm really lucky for. So whenever I get cleared, we will be heading home. So for this fusion surgery, there will be a bone graft. Mine will be used with crushed bone from the bone bank and harvested bone marrow from my own body. I know my surgeon used to use rib bone from your own body, and a lot of the patients had very long-term rib pain because of that, so he's moved to using crushed bone. There are actually a couple areas where I've read pretty much every paper he's ever published, and there are several areas like this rib bone pain where he's evaluated his patients and really used their thoughts and feelings and experiences from the surgery to make the surgery better. So some of his old patients had a lot of pain from the screws in the hardware, so he developed his own equipment that will go in the neck that doesn't have screws, that the screws are like inlaid into it, so there's no pain from that. And I just think that's really powerful that he cares about his patients' experiences and is making the surgery better for the future. So the hardware will be titanium screws, rods, and plates, but they're all MRI compatible, which is really great. So there won't be any kind of long-term issues with that. The incision will be at the base of my neck, so kind of like the base of the skull. It's not supposed to be much more than like 4 inches or so. So I'm going to kind of get into the nitty-gritty of the surgery, so if you don't want to hear that, skip to the next section. But I'm reading off a nice little form he gave me. Well, I'll summarize. But for the procedure, you're placed under general anesthesia, and then they use something called a Mayfield headrest, which is kind of like a metal ring that's placed around your skull, and it's fixed in place, so it's like firmly gripping your head. You're face down, and they do an x-ray on you to confirm that your positioning is good, like everything's lined up in your neck where it should be. So then they kind of do the incision. I mean, they don't kind of do the incision. They do the incision to get to the place in there that they need to be at. So that, from my surgeon, it will do the decompression first. So they'll go in and remove part of my foramen magnum, which is the skull at the base of your neck where my cerebellar tonsils are extending. So hopefully that will decompress my skull. So then they readjust your positioning after they do the decompression, just to make sure that it's where it needs to be, with your spine and your skull. They lock your headrest, the Mayfield headrest, into place again at the normalized angle, when like clivo-axial angle, those things are in the optimized position, and that is a big part of the surgery. They will be using an x-ray to kind of live see what's going on while they're moving my head, and they will keep changing it up until they find the exact right position. One of my biggest fears is my head being fused in the wrong spot. Like, I'm scared it's going to be fused like this, like looking down, and I have voiced that opinion and was told that they do a lot of work to make sure your head is at the right angle. So then they kind of just make sure everything is right, scrub back into surgery, and then they can place the screws. So there's screws placed into C1 and C2, and then a plate placed on the back of the skull. So there's small titanium rods that will connect the skull to the spine. And this is hopefully making that normal cranio-spinal relationship to make sure it's more stable than it was before. So then they'll use the bone graft from the bone bank and bone marrow concentrate to position the graft in those places that are being fused together. So that's kind of the procedure. There's obviously a lot of complications that can happen, and I am informed of all of them. Some of the complications, you're intubated, so I know a lot of people wake up with no voice or their throat's really sore. The headrest is like, it's not screwed into your skull like a halo, but it is very tight, so sometimes that can hurt. You are being put to sleep, which always has a risk. You can develop a spinal fluid leak from a tear in your dura. I'm pretty prone to spinal fluid leaks, but so are most people with EDS, so my surgeon's very aware of this, and hasn't had many in his history that he's aware of, at least. Obviously they could have complications placing the screws, which could injure a lot of, I don't like to think about this stuff, but I want to be fully prepared. It's surgery near a lot of really important things, your brainstem, your spinal cord, your brain. I mean, there's a slip in one direction or another could be really devastating, so I'm very aware that kind of whatever could happen during this, but I think if I'm having this surgery, I'm having it by the absolute best person on this planet, so I trust my surgeon, and I'm hopeful that none of that stuff will happen to me. But yeah, you could have a spinal cord injury, you could have issues with like your nerve roots in that area, which could cause a lot of headaches. You could obviously have a bleeding problem from the surgery. So my surgeon collects research on his patients. They're expecting that I'll have an improvement. It's been observed in 90% of their patients that they have improved after the surgery, but obviously I can't make any guarantees. So my thoughts on the surgery, it's kind of hard to put into words all that I'm feeling. I feel like this video could be 4,000 hours long. But going into my first appointment with him, I didn't even know that I had CCI. I didn't know that a fusion was, an option for me. But after he mentioned it at my first appointment, I kind of assumed that was where we were headed. At my second appointment, he didn't even hesitate that this is what I need, this is what we should do. I was not shocked. My mom was very shocked. I guess she wasn't expecting that, so it took her a long time to kind of get on board. But for me, it kind of gave me hope for the first time in a while. I'm not a big surgery person. I, want to try every other outlet before that. But this surgery gives me a lot of hope that I haven't had in a really long time, that there is a better future for me. My quality of life is pretty poor. I don't want to get emotional, but yeah, I was just talking with my mom this morning, and she sent me a video from a year ago where my daughter was sitting in her high chair. She would have been like 18 months old, and she was telling me the whole digestive process, because I had taught her you eat food and then it goes down your throat and into your stomach and then your intestines, and that's called digestion. And she could quote all that back to me, and my mom was like, does she still know this? And I was like, no, she doesn't, because that was back when I was a good mom and went over those things with her, and now it's like, hey, come lay on the couch with me and watch a movie again. So I'm really looking forward to getting back to being the mom I want to be, which I can't be from the couch. Obviously I'm scared of the surgery. Somebody told me when I was pregnant that before you have kids, you're invincible, and it's not until after you have kids you realize you're not, and it really is true, because, before I had kids, it didn't really matter, if my life ended or, it was just me, so what does it matter? But now I would be leaving behind a 2-year-old, which I don't want my daughter to grow up without her mom, so surgery's scary. I don't want anything bad to happen to me. I don't want to come out worse than I am, but I'm not really seeing any other options right now. And I trust my surgeon, but my surgeon is a surgeon. That's what he does. He does surgery. So I wanted to get some other opinions from non-surgeons. I know most people will seek second, third, fourth opinions from the other experts. I didn't go that route because I wanted someone closer to me to evaluate. And I went to my physical therapist, which I wouldn't suggest going to your physical therapist to tell you if you should have surgery or not. I just went to mine because she is a lifelong friend of my husband, and she's an expert on EDS. She's recommended by the Ehlers-Danlos Society, so she's kind of familiar with what surgery could look like on someone like me. And I wanted someone's opinion who, I feel like physical therapists, they're about surgery when it's needed and warranted, but let's try the other outlets first. And I wanted someone with that mentality to evaluate my case. So she has all my imaging and she has all the reports, and she time and time again has said absolutely that I need to have this surgery. If I was her family, not only would she want me to have it, she would want me to have it now. And that kind of makes me feel a little bit better. You know, post-surgery, I will probably lose about 50% of movement of my neck, which a lot of people worry about. I'm not that worried about it because my neck hurts so bad since I've been 16 that I don't turn my head anywhere. I'm very used to turning my body, so I'm not super concerned about that. And also people with EDS, because there's so much extra movement throughout the rest of my spine, I should get a pretty good range of motion back, but my physical therapist says come back when I'm cleared for PT, and she will get me back up to where I need to be. So I feel like I have a really good team. I know my surgeon's really good at post-care, so I feel like I'm finally 100% accepted that I will be having the surgery. I'm very type A. I'm a planner and I want to know everything. So the second I got home from my appointment where surgery was scheduled, I probably spent 90% of the day, every day for the next month or so, researching the surgery, researching my surgeon, going down Reddit rabbit holes, which I really don't suggest. Honestly, being super creepy and like finding people on Instagram who had this surgery and messaging them, because I know my experience won't be their experience and their experience won't be mine, but I just wanted to know everything I could about the surgery and the process and my surgeon. And you know, there are people out there who don't believe CCI is real. They don't believe you should do surgery on Ehlers-Danlos patients. They believe some of the surgeons in this field just want to do surgery on everybody. And reading some of that was kind of hard, and I don't suggest it because it really made me doubt what my medical team was saying for a while. I am thoroughly aware I could have a bad outcome. I could come out in more pain than I am now. I'm not in a ton of pain now. My life is pretty miserable, but I wouldn't call the misery pain per se. I don't know. I'm not in a ton of pain. So then I'm like gaslighting myself, like, am I bad enough to have this surgery? So the first couple weeks were really hard where I was feeling all those things. Now I am a couple months post scheduling my surgery, a couple weeks. I don't know. Time flies when you're just sitting on the couch all day. But I'm seeing my quality of life literally deteriorate every single day. So I'm ready, and I will keep you guys posted throughout the process. I'm starting to do pre-op stuff pretty soon. I am 6 weeks out from surgery. So I'll keep you updated through my pre-op process and through my surgery. It's really hard for me to be this like vulnerable and raw and like let people I don't even know see me like cry and see me post-surgery, but the other people out there who have done that have been such a blessing to my life that they gave me this picture of what this process looks like for me, and I want to be able to add to that collective of information out there for future people who will have these things done. So I will keep you all posted on the journey, and I'll probably